Reclast Infusion is a medication used to treat bone diseases such as Paget's disease and osteoporosis. It works by slowing down the breakdown of bone and keeping bone strong, reducing the risk of fractures. This medication belongs to a class of drugs known as bisphosphonates. It is also used to treat or prevent osteoporosis in people who are taking corticosteroid medications for long periods. The optimal timing for this medication is typically in the morning, and it is usually prescribed once a year. Always follow your doctor's instructions for the correct dosage and timing. Remember to always read the medication guide and patient information leaflet before using Reclast bottle, infusion. This medication is given as a single dose as directed by your doctor, slowly into a vein over at least 15 minutes. The dosage is based on your medical condition and response to treatment. Make sure to eat and drink normally on the day of treatment and drink at least 2 glasses of fluid before treatment unless otherwise directed by your doctor. It is important to get plenty of fluids when you are given this medication. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check for particles or discoloration in the product. If either is present, do not use the liquid. Avoid mixing zoledronic acid with 4 fluids that have calcium in them and talk to your pharmacist for more details. Your doctor may direct you to take calcium and vitamin D each day. If you have Paget's disease, it is especially important that you take the directed amount of calcium and vitamin D during the 2 weeks after your zoledronic acid dose. Tell your doctor right away if you have any symptoms of low calcium such as numbness/tingling and muscle spasms. For the treatment of Paget's disease, this medication is given as a single dose and may be repeated based on your symptoms. For the treatment of osteoporosis, this medication is given as a single dose once a year. Remember to talk to your doctor about the risks and benefits of long-term use of this medication. Some common side effects of Reclast infusion may include nausea, tiredness, flu-like symptoms, dizziness, headache, or pain/redness/swelling at the injection site. These side effects are usually mild and occur within 3 days of treatment. If you experience flu-like symptoms, you can take acetaminophen or ibuprofen to help reduce them. If any side effects worsen or last more than 4 days, it's important to tell your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. If you experience any of the following serious side effects, it's important to contact your doctor immediately: increased or severe bone/joint/muscle pain, new or unusual hip/thigh/groin pain, jaw/ear pain, unusual weakness, eye problems, muscle spasms, numb/tingling skin, irregular heartbeat, or sores in the jaw/mouth. In the rare event of a serious allergic reaction to Reclast, seek medical help immediately if you notice any symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting treatment with Reclast, it's important to tell your doctor or pharmacist about any allergies you have, especially to bisphosphonates like alendronate or risedronate, or if you have trouble breathing after taking aspirin. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Additionally, it's important to inform your doctor about your medical history, especially if you have kidney problems, low calcium levels, or if you've had recent dental surgery. Some people using Reclast may experience serious jawbone problems, so it's important to have a thorough dental checkup before starting this medication and to inform your dentist about your medication. Before undergoing any surgery, including dental procedures, be sure to inform your doctor and dentist about your use of Reclast. They may advise you to stop using the medication before surgery, so it's important to follow their instructions carefully. It's also important to be aware that Reclast may cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you are sure you can do so safely. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as Reclast may stay in your body for many years and could harm an unborn baby. Reliable forms of birth control should be used while taking this medication and after the last dose. Finally, it's unknown if Reclast passes into breast milk, so it's important to consult with your doctor before breastfeeding while using this medication. When taking Reclast, it's important to be aware of potential drug interactions, as they could affect how the medication works or increase the risk of serious side effects. It's crucial to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Reclast is calcium-containing 4 fluids. Additionally, it's important to note that there is another zoledronic acid product used to treat bone problems related to cancer, and it should not be used together with Reclast. Always consult your doctor for the best guidance on the use of this medication. If someone takes too much Reclast and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Making lifestyle changes to promote healthy bones is important, such as increasing weight-bearing exercise, quitting smoking, limiting alcohol, and eating a well-balanced diet with enough calcium and vitamin D. You may also need to take calcium and vitamin D supplements, so it's best to consult with your doctor for personalized advice. Before starting and while using Reclast bottle, infusion, you will need to undergo lab and/or medical tests, such as checking your calcium/phosphate/magnesium blood levels, bone density tests, and kidney function. It's important to attend all your medical and lab appointments and consult your doctor for more information. The Reclast infusion is used to treat and prevent osteoporosis in postmenopausal women. It is also used to increase bone mass in men with osteoporosis. This medication is given as a slow infusion into a vein, usually once a year. It is important to follow your doctor's instructions for the timing and dosage of this medication. The best time to take Reclast is when you can schedule it as a yearly appointment with your healthcare provider. This will help ensure that you receive the full benefit of the medication. Be sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets. Also, do not flush medications down the toilet or pour them into a drain unless instructed to do so. When you no longer need the medication, be sure to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.